Let me be very direct with you right now. What if I told you that your feet, yes, your feet, have been trying to warn you about a deadly disease for months, maybe even years, and you have been completely ignoring them? Right now, as you are watching this, there are over 400 million people walking around on this planet with undiagnosed diabetes. They are going about their daily lives, eating, working, sleeping, completely unaware that a silent storm is brewing inside their bodies. And here's the terrifying part. By the time most of them find out, the damage has already begun. Nerve damage, kidney failure, vision loss, and, in the worst cases, amputation. Every 30 seconds, somewhere in the world, a leg is amputated because of diabetes-related complications. Every 30 seconds. I am doctor speaking to you today, not to scare you, but to save you. Because your body has been sending you signals. Quiet, easy-to-miss signals, and today I am going to decode every single one of them. The warning signs are not in your blood report. They are not in your chest or your stomach. They are right there at the bottom of your body. Your feet know the truth before your doctor does. So before you take another step, watch this entire video. It could literally change your life. I have been practicing medicine for years, and one of the most heartbreaking things I see in my clinic is patients who come in with advanced diabetes complications that could have been caught years earlier. If only they had known what to look for. Today, I'm going to make sure that never happens to you or anyone you love. The first warning sign is numbness or tingling in your feet. I want you to imagine putting on a thick wool sock, that feeling of something being slightly muffled, slightly distant. And now, imagine feeling that way in your feet all the time, even when you are barefoot. That is exactly what many of my patients describe. This sensation is called peripheral neuropathy, and it is one of the earliest signs that diabetes is quietly attacking your nervous system. High blood sugar over time acts like acid on your nerve fibers. It slowly erodes the protective coating around your nerves, starting from the tips of your toes and working its way up. One of my patients, a 47-year-old schoolteacher, came to me complaining that her feet felt like they were asleep all the time. She thought it was her shoes. It was not her shoes. Her fasting blood sugar was 240. If you feel persistent, tingling, buzzing, or numbness in your feet, especially at night, do not ignore it. That is your nervous system sending you an SOS. The second sign is foot pain that gets worse at night. Most pain during the day makes sense. You have been walking, standing, working. But pain that intensifies when you lie down in bed, when everything should be relaxed, that is deeply suspicious. Diabetic nerve pain often follows this exact pattern. I had a 52-year-old businessman who told me he had not slept properly in 6 months because of burning pain in his feet every night. He had been taking painkillers assuming it was arthritis. When we ran his HbA1c test, it came back at 8.9, well into the diabetic range. The reason nighttime pain is worse is because during the day your mind is distracted. At night, in the silence, the nerve pain becomes impossible to ignore. If you are lying in bed right now with burning or stabbing foot pain, please write down the time and frequency. That data matters when you see your doctor. The third warning sign is changes in skin color on your feet. Your feet should be a relatively consistent color, matching the rest of your skin tone. But in people with hidden diabetes, the feet can start to develop strange discolorations. You might notice a yellowish tint, dark patches around the ankles, or a condition called diabetic dermopathy. Small, light brown, scaly patches that look like age spots but are actually caused by changes in the small blood vessels due to high blood sugar. One of my elderly patients kept blaming her foot discoloration on her gardening and outdoor work. But when I looked closely, the pattern was too uniform, too symmetrical. Her glucose test confirmed diabetes. The skin is a mirror of what is happening inside your blood vessels. Do not dismiss unusual color changes as cosmetic issues. The fourth sign is slow-healing cuts or wounds on your feet. This one is particularly dangerous because it is the gateway to the most serious complications. Here is what happens inside the body. High blood sugar impairs your immune response and reduces circulation to the extremities. When you get a small cut or blister on your foot, your body would normally rush white blood cells and nutrients to that area to heal it within days. But in a diabetic patient, that response is sluggish, incomplete, and sometimes almost non-existent. I once treated a retired farmer who noticed a small blister from his boot that simply would not heal. 1 week became 2, 2 became 4. By the time he came to see me, the tiny blister had become a serious ulcer. We caught it in time, thankfully, but thousands of people every year are not so lucky. A wound on your foot that takes more than 2 weeks to heal is a red flag that demands immediate medical attention. The fifth warning sign is swelling in the feet and ankles. Now, I want to be careful here. Foot swelling has many causes, including standing for long periods, heat, and certain medications. But when swelling in the feet and ankles becomes a consistent, daily occurrence without an obvious reason, diabetes must be on the list of suspects. High blood sugar damages the kidneys over time, and when kidneys are not functioning properly, fluid builds up in the lower extremities. Additionally, damaged blood vessels lose their ability to regulate fluid properly. I remember a middle-aged woman who came to me with shoes that had started feeling tight by noon every single day. She had assumed she was just retaining water from her diet. Her kidneys were already showing early signs of diabetic nephropathy. Catch it early, and you can slow it down significantly. Miss it, and the damage compounds. The sixth sign is foot cramps, especially at night. Leg and foot cramps are incredibly common, and most people dismiss them as dehydration or overexertion. But persistent, severe cramping in the feet and calves at night can be a symptom of poor circulation caused by diabetes. When blood vessels are damaged by chronically high glucose levels, blood flow to the muscles becomes inconsistent. The muscles cramp because they are literally not getting enough oxygen and nutrients. Think of it like a garden hose with a kink in it. The plants at the end of the hose are not getting enough water, and they start to wilt. Your foot muscles are those plants. If you are waking up multiple nights per week with foot cramps that seem to have no explanation, add this to the list of symptoms to discuss with your physician. The seventh warning sign is dry. Cracked skin on the heels and soles. Everyone gets dry feet occasionally, but in diabetic patients, the autonomic nerves that control sweat glands in the feet are damaged, which means the feet stop sweating properly. The result is chronically dry, rough skin that cracks deeply, especially around the heels. These cracks are not just uncomfortable, they are open doors for infection. I have seen patients who had deep heel fissures that became infected within days simply because of routine walking. They had been using moisturizer for months, thinking it was a cosmetic problem, never knowing that the root cause was metabolic. If your heels are persistently cracked despite regular moisturizing and good footwear, diabetes may be the underlying reason your skin cannot maintain its natural moisture barrier. The eighth sign is changes in the shape of your feet or toes. This one surprises most people. A condition called Charcot foot, one of the more advanced complications of diabetic neuropathy, causes the bones of the foot to weaken and fracture due to the loss of sensation and the mechanical stress of walking without feeling pain. Over time, the foot can actually change shape, developing a characteristic rocker bottom appearance. Even earlier and more subtly, toes can begin to curl or contract into what we call hammer toes or claw toes, partly due to nerve and muscle imbalances caused by neuropathy. I treated a 60-year-old retired teacher whose feet had gradually changed shape over 2 years. She thought her feet were just aging. She had type 2 diabetes that had gone undiagnosed for nearly a decade. If your feet look different than they did a few years ago, if toes are shifting or bones seem more prominent, that warrants an evaluation. The ninth and final warning sign is a loss of ability to feel temperature in your feet. Here is a simple test I give my patients. Fill 2 bowls with water, 1 warm and 1 cool. Close your eyes and put 1 foot in each. Can you clearly tell the difference in temperature? Most healthy people can do this easily, but patients with diabetic neuropathy often cannot. The temperature-sensing nerve fibers are among the first to be damaged by high blood sugar. This is clinically important because a patient who cannot feel heat may step on hot pavement, leave their feet too close to a heater, or get into a bath that is dangerously hot, and sustain serious burns without realizing it. I had a patient who had a second-degree burn on his foot from a hot water bottle he used at night. He had felt nothing. This loss of protective sensation is a medical emergency that requires immediate diabetic foot care protocols. Now, I want to take a moment to connect all of these signs together for you, because understanding the pattern is just as important as knowing the individual symptoms. Diabetes is a disease of the blood vessels and the nerves, and in the human body, the furthest point from the heart, the point with the smallest vessels and the longest nerves, is your feet. This is exactly why the feet are the earliest warning system. They are the first tissue to suffer when blood sugar begins to damage the vascular and nervous systems. By the time you develop symptoms in larger organs like the kidneys or the eyes, the process has often been underway for years. But your feet will tell you much, much sooner. So here is what I want you to do today. Not tomorrow, not next week, today. Take off your shoes and your socks. Look at your feet carefully. Check between your toes, examine your heels, press gently on different areas and note whether you feel pressure evenly. Run a finger lightly across the top and sole and check for areas of reduced sensation. Look for any discoloration, swelling, wounds, or unusual dryness. Do the temperature bowl test I described. And if you find even 2 or 3 of the signs I have described today, schedule an appointment with your doctor and ask specifically for a fasting blood glucose test and an HbA1c test. These are simple, inexpensive blood tests that can tell you definitively whether diabetes is present. Do not wait for symptoms to become severe. Do not wait until a wound will not heal or until your feet have changed shape. Early diagnosis of type 2 diabetes is one of the most powerful medical interventions available, because at the early stage, lifestyle changes alone can reverse the trajectory entirely. I want to leave you with this thought. Your body is extraordinarily intelligent. It does not develop symptoms randomly or without reason. Every single sign I described today is your body's attempt to communicate with you, to reach across the noise of daily life and say, "Something is wrong. Please pay attention." The tragedy of diabetes is not just the disease itself. It is the years of silence before diagnosis, the missed signals, the dismissed symptoms, the patients who tell me, "I wish I had come in sooner." I do not want that to be your story. You now know what to look for. You now have the knowledge that can make a real, tangible difference in your health and in the health of people around you. Share this with your parents, your siblings, your friends, especially those who are over 40, overweight, sedentary, or have a family history of diabetes. They deserve to know. Your feet have been trying to tell you something. Today, you finally learn to listen. Take care of your feet, get tested, and take control of your health, because you absolutely deserve to live a long, healthy, vibrant life, and it starts with the ground beneath your feet.